Okay, it is October 20th at 1 p.m. and I'm calling to order the Platte City County Board of Health meeting. Do attendance, please.
Artis here. Dawn,
Here.
Jessica,
Here.
Pam,
Here.
Pete, Rod.
Here.
Roger's not here. Ronald.
Here.
Okay, and I should have added to that Roger is not with us today, but I think the rest of the board members are. So I would take an approval of our agenda. Everyone get a chance to look at it?
Yes. Make a motion to approve today's agenda. Second.
All right, any discussion on that? All in favor? Oh, roll call.
We're gonna do roll call.
Roll call.
Okay.
We usually do that.
Artis. Yes. Dawn,
Yes.
Jessica,
Yes.
Pam,
Yes.
Rod,
Yes.
Ronald.
Yes.
Okay, and we just had Pete, Dr. Pete Honeyboard join us. Welcome.
Right.
All right, so with that, we'll go to citizen comments. Do we have any written? Online?
No.
Anyone in the audience want to give verbal comments? Or is that- All right. Right, did everyone get a chance to look at the minutes of September 15th? I'd like to entertain approval on those, or minutes, whatever.
I'll second that.
Motion on the floor, any discussion? Hearing none, all in favor? No, we do roll call, right? I keep thinking of commissioner changes.
So Artis,
Yes.
Dawn,
Yes.
Jessica,
Yes.
Pam,
Yes.
Pete,
Yes.
Rod,
Yes.
Ronald.
Yes.
Right along here, we go to our departmental rep reports. And that's a $20 fine in the commissioner's office. I just want to check. Okay. Animal shelter.
It might be on his way, so.
Okay, so we'll go down and we'll just wait. And put that aside for a minute. Community health.
Hello, everyone. Okay, so just a couple updates for community health programs. So we are fully staffed, which is amazing. Community health section, I actually think the entire health department is fully staffed if I speak on that part. Going through our reports, our immunization clinics, the couple things to point out. In August and September, we did about 20 COVID tests per month, as that's something that new capacity that we implemented. We did have our medical director meeting for the first time in, since 20. Yeah, COVID happened. So that was great. That was amazing to all get in the same room with our medical director, Dr. Cole, and talk. Catch up and then plan out some projects that we're gonna all be working on and moving towards. That was a really fun thing that we did for our immunizations clinic. I think he would like us to schedule those monthly or so, but we will look at our schedule and see how frequently we're able to accommodate those. Our WIC numbers, they are down slightly per our steady usual 1,000 participant average, solely just because we only had one dietitian actually working those last 2 months. We were in the process of hiring staff, but our WIC training takes about a month's time. So they are just now up and operating for our caseloads for October. So I anticipate those numbers to bounce up over the next couple months, right back where they were. And then we'll start implementing our outreach to build those participant caseloads even further. As that is part of our plan for the next fiscal year. For home visiting, we're doing steady. Once again, we had a new staff member start, and it takes about a month's worth of training for PAT. So she just finished that, and she's working very diligently on the referrals we are giving her left and right to build her caseload. We did 10 outreach contacts in September for home visiting. Just to give you guys an idea of who we contact and make outreach to, we did Imaginative Libraries, Western Montana Mental Health, Sprouts Daycare, Sunburst, Youth Dynamics, Aware, Clear Choice Clinic, Head Start, and the Homeless Liaison with Kalispell School Districts / the Heart Locker Manager. And asthma, steady. Rebecca continues to do amazing with asthma. Caseload is over 100% actually. And this morning she reported she had 16 on her caseload of the required 15 that the grant wants us to have. And then she's working on 4 additional. So continuing to thrive in our asthma program. And then for MCH, our new year just started. So we have our new projects that we are implementing. They are still safe sleep related, just like last year, since we got a lot of kudos from the state. We decided to continue it and further expand upon that. And then we'll probably give you an update on our FICMR activity next year after we get it rolling, which is on suicide prevention, gun trigger locks. Just to give you an update on that. Anything to add, Jill? Jill is the community health supervisor, so.
The flu number looks low on our
We need
report.
to hear from Mike.
The flu number looks low on our report because we didn't get our flu vaccine until basically October, like very end of September. But we are now like well over 1,800 people because we had our flu clinic, or not 1,800, probably more like 1,500. So we had our flu clinic that we did like 1,100 last month, or this month. So I'll point that out if you're curious of why we only did 94 people.
Anyone have any questions with community health?
All right, thank you. Okay, I think we'll go back to animal shelter. Yeah. Good afternoon.
Good afternoon, my apologies for being late. I want to report today to you kind of an informational problem that's come up that we haven't seen for quite a while. We're getting tremendously high numbers of dogs in the shelter, mostly in the form of owner surrenders, faster than we normally adopt out. And so to give you an idea, we have 42 kennels there that we dedicate to housing of the normal strays and owner surrenders that come in. And we have 4 kennels that we pulled for animal control that are for quarantine, rabies quarantine, for court cases, that sort of thing. And we keep 3 other kennels open for nighttime intakes from law enforcement. So today we have 39 dogs in our care. And so I called first health officer, Jennifer Winkowski, and I said, at what point are we full? And what do we do when we have more dogs needing to come in? And she said, well, question. And so between the 2 of us, we talked to David Randall in the county attorney's office. And so basically, and the driver of this really seems to be the housing shortage has exacerbated the tenant market for landlords that allow pets. And it seems like every time somebody has to move now for whatever reasons, they're having a harder and harder. So that's what seems to be driving the relinquishment. The amount of strays coming in is about the same. So we're kind of here to seek some guidance and some suggestions, and from both the commissioners, and kind of what we're up against, the ordinance itself that calls for dogs to be brought into the county's municipal shelter really can't be changed to reflect the housing problem, because there isn't anything in the Montana Code annotated that addresses housing numbers or housing sizes and that sort of thing. So we're kind of left with a lot of shelters in the United States, municipal shelters in particular, have to turn to euthanasia to make space for incoming animals. And I think we'd all like to avoid that if we can. A couple of other things that we're considering and we're gonna try where we're allowed to are things like maybe adoption fee, waived adoptions until we can get some relief. There are boarding facilities out there, and it costs the county about as much to house animals if we divide our budget by 365 and the average daily census there. So that's certainly something to explore. And we're not utilizing all the social media track programs that help people that want to try and rehome their animals themselves. And that'll probably take a little work with the IT department to see what sorts of things we can have on our website. But really, what we need is some, and David Randall's suggestion was starting with this board for guidance and suggestions, and then, of course, taking it to the county commissioners and seeing what they feel might be approved and allowed.
So prior to doing that, we're gonna have a meeting. So we're gonna meet with animal control, we're gonna meet with us, and then hopefully Malia to do some sort of outreach first. So we haven't reached that tipping point yet, but we want to try to get an emergency plan in place so that we can have something to look at and fall back on and say, okay, this is what our plan is. So we want to work with the sheriff's office or animal control as much as we can. Is there education that we need to do? Is there fosters we need to reach out to? I mean, there's multiple things that we can try. But if you guys have any suggestions or anything like that, please feel free to, if you have any ideas, please feel free to reach out to us and we will, take them into consideration. But we do want to work with our partners first and then come up with a plan. And then if we reach that tipping point, then we might have to do some other things. But what we do with the cats, because we don't have a cat ordinance, meaning that we don't have to take in every single cat in the valley. We have a waiting list. So is it a waiting list? Can these people hold on to these animals for just a little bit longer while space opens up? And then Cliff gives them a call and then they can bring the animals in. So we're going to try some things first as well. So any suggestions, please email us and we will get those to our kind of little subcommittee we're going to have and try to go from there.
Can I ask a question?
Sure.
Can you comment on the dogs that were released up by Hungry Horse Reservoir? Do you still have those animals and do you know where they came from? And will they be relocated to where they came from?
All but two appear to be adopted, and we have adoption appointments to see them. And I have reached out to some of our partner shelters, and there's a shelter that will take the remaining two if the adoption appointments don't work out. So we're pretty well through those.
And
is
Jessica,
there-
yes, we do know where they came from. I think they're working, it's the law enforcement that's working on that side of it.
Okay.
That they know where they came from and that process is well on its way. But because the individual abandoned abandoned the animals, then that means that we were able to adopt them out. So it had to be held for a criminal case.
And then just one more question regarding the space issue. Is there any way that you could utilize the new building that you just built for temporary housing for the smaller dogs, like in large crates or kennels?
Yes.
Which if you guys haven't found it, look at it, it's beautiful.
Did you hear his answer, Jessica?
I did, thank you, yep.
All right,
I have a question.
yes, Don.
Just for clarification, you were saying the cost of having a local kennel take some of our animals. How much more is that than what we end up spending on that?
I used to update that every year, but it costs the county, if you use the math formula of our total budget divided by 365 days, divided by the amount of average cat and dog numbers, works out to be about 35 a day. And that's about what most kennels are charging.
Okay, thank you. I'm sure you guys will look at that.
Okay, any other questions or thoughts? Yes, Rob.
Thank you, Cliff. I had this conversation with you back in February, and I was at that point asking about numbers if we had another recession, you know, if people start abandoning pets and that sort of thing. And you've indicated this is more of a housing issue, but I'm sure that some of that might be consumer spending issues as well. So I'm just wondering if, when you're asking those folks, you know, are you vetting that? And it would be an uncomfortable thing to say we can't afford the pet, you know, and blame it on housing, but maybe if we could incentivize donations of dog food or something, if people are having problems with that, if that would be something. And the other thing was, years ago, I actually fostered some dogs from the county. Is that a program that's still happening? Is that a way we could maybe alleviate that?
Well, first, actually, all surrenders are going through me right now for an interview. And so I've been able to gently ask those types of questions. And it seems the lion's share are, I mean, if I can find the time, I'll start tracking it. But way over half of the people say, I have to move, I've got a divorce, I've got a growing family, my landlord sold my house. So, and I cannot find pet-friendly landlords. So as far as food and that sort of thing, food's not really an issue, it's space. So, and yeah, if the economy gets worse, we'll probably have people that just say, I don't have to move, but I can't afford my pet anymore. And we do get a lot of donated food. We could certainly incentivize those people. And that's part of this interview process too. Is there anything we can do? Sometimes it's a fencing issue and sometimes we can fix that. And sometimes there are things that once in a while we can fix, but by and large, you know, you just can't fix. I can't find a landlord to rent to me. And that won't go away. And the population is growing, you know. It may be that one day we need to expand the shelter. So for now, we'll, as Jen said, we'll try some of these other measures. It could be that it was a run of bad luck where it seemed like every day, 4, 5, 6 people were calling to surrender their dogs. It didn't just seem like it was that. And we don't adopt 4 or 5 out every day. And it used to run about 50-50 on strays and owner surrenders, and we have a terrific return to owner rate for strays. But these are owner surrenders that we're dealing with. Just can't seem to fix that problem.
And regarding the foster program?
We have a foster program, and we need to probably increase it. The bad thing from the shelter standpoint is when dogs aren't in the shelter, they can't be seen. It's harder to make appointments because you're dealing with somebody else who's helping you out, but it makes it more difficult to get the animals out. So it's great for temporary space relief. And we'll certainly try and use more of it.
Thank you.
Okay, any other questions here or online? Anyone online? All right. Yeah,
Thank you.
thanks, Glenn. All right, next is population health.
Okay, I'll just touch briefly on the breast and cervical program. We've had the mammo bus here, and then we had some other screening events this last month. So those have been pretty successful and our numbers are continuing to increase after COVID, which is really encouraging that we're getting more women screened. The bad news on this is that Kirk and I had a talk with the breast and cervical health program at the state level. The CDC got a budget cut of 30 million at the breast and cervical. So then they put it down to the states. So they're estimating potential $62,000 cut to that budget, which is basically a full FTE, but we did have somebody leave. So Kehlani did say that we're fully staffed, but, and we are. What we'll probably do is we're gonna have to look at just shifting some things and moving people into other programs to help keep that program going the way we would like it to go and the way it's been going. And then also to help some other programs. So we're looking at that, but we had that meeting this week and that was a big budget cut. But they're just anticipating it for the next year. So Kirk and I will work through that. And then I'll let Lisa report on any CD information.
Good afternoon. As far as the report goes, not too many outliers. It's pretty standard, except the Lyme disease. That case did travel to the west or east coast and did indicate they had a tick bite. So definitely nothing that was contracted here. Influenza, we have kickstarted our influenza season. We put out a press release, I believe it was September 30th, indicating that we've had 2 confirmed influenza cases, which actually is before we technically start the influenza season in terms of counting our reported cases, which is usually the first week of October. But thus far, we've had 5 confirmed influenza cases, with 2 of those being prior to October 1st. So with that, we're really just stressing for folks to get their influenza vaccination. You know, kind of we're on the street with what we've heard with the Southern Hemisphere. They had a very early and rough influenza season, which could be a potential predictor what we might see for our season. So sometimes it materializes, sometimes it doesn't. So regardless, we want people to be prepared. And the best way to do that is to get your influenza vaccination preferably before the end of October. Ebola, some of you have probably heard in the news that Ebola is rearing its ugly head again in Uganda. So, and we are definitely in the business of preparing and preparation. So we're just kind of revisiting our materials and resources for Ebola response and talking with community partners, just in case we have a traveler that comes from that area that needs to be monitored, or anybody, travelers that might come back with any Ebola related concerns. So just preparing for that. School presentations. Our staff, specifically John Griffin, is working really hard on getting our school presentation materials revamped and reviewed. It's been quite a few years since our communicable disease program has been in school. So we're really excited to get back in there just to talk about hand hygiene, food safety, communicable diseases, and things like that. And John has been doing a great job with actually collaborating with other divisions of our health department. So with environmental health and with immunizations to make sure that we have a well-rounded presentation for that. So kudos to John for getting that back up and running and reaching out to those schools. And so far, we've had some good feedback in terms of people, schools that want us to come in. So lastly, I just wanted to give a huge thank you and shout out to our communicable disease staff. Sorry if I get emotional, communicable disease is very important to me. Within this last year, we've hired on some amazing staff members. I don't have nothing but good things to say about them. They're intelligent, hardworking, innovative, and I'm just so excited to have them on board and taking us into the future. So, any questions?
Great. Any questions? All right, thank
Thank
you.
you.
Next is family planning.
Good afternoon, everyone. So patient numbers have been staying steady compared to last September. We have about a 20% increase in patient visits. We launched our PrEP campaign. I talked about that last month here at the Board of Health. So we're promoting prep visits and getting people prescribed prep for $30 or less a month. And in just a few short weeks, we almost doubled our prep patient visits. So our outreach is working, and this is really promising when we're trying to address HIV prevention efforts. The American Society of Emergency Contraceptive asked me to speak at their national conference that was held last week. We discussed our clinic's approach to bringing awareness and dispensing emergency contraceptive in our community. That group is now creating a toolkit based on our approach for other clinics to use as a resource. With the warming shelter opening back up, we started providing on-site services there once a week, which includes HIV and hepatitis C rapid testing. We also partnered with the Hungry Horse Clinic and are now offering HIV and rapid hepatitis C testing on a walk-in basis. So folks can access those services just by walking in on Mondays. For the month of September, we collected more syringes than we gave out, and it looks like our participants have been doing a really good job with our new return policy. Lastly, we held our first Narcan community training here at the health department. And it was really interesting. We had folks from lots of different backgrounds that attended the training. Someone from Two Bear Search and Rescue came, another person came that was representing their church. And it just felt like a really successful training, getting the community trained on how to respond to an overdose. And so we're already planning our next training, and this is definitely a service we're going to continue to offer to the community. Any questions? Thanks so much.
Good afternoon, I'm Jim Wardetsky with Environmental Health. This past month, our phone call numbers and walk-in numbers are down slightly from the previous month. This past month, we had 1,015 phone calls equating to 35 hours and 14 minutes worth of phone time for our staff, 360 walk-in customers, which is down from 1,300 calls and 400 walk-in customers. The point I'd like to make about that is, despite the numbers being down, we're seeing some more complex issues within our office that we're dealing with that are taking more time despite the numbers being down. So, our staff is fielding numerous septic complaints ranging from illegal septic systems being installed to the smell of sewage coming from neighboring properties. Other complaints include unlicensed vacation rentals, air quality complaints regarding burning toxic items, dust from construction sites going unabated, food complaints pertaining to suspected foodborne illnesses, and facilities having pest control problems. The land and septic staff have been faced with some very difficult scenarios as a result of properties being sold and developed that once were considered undesirable due to high groundwater, setbacks, and topography. They've had to engage in difficult conversations with engineers and property owners to educate and guide people through the complex process of septic systems being designed and installed. The food sanitarians provided excellent training at Flathead Valley Community College recently regarding their ServSafe program. The ServSafe program is a great example of how the health department partners with community entities to bring valuable service to the public. Beyond the ServSafe training, the sheer number of inspections that our four food and consumer sanitarians conduct every month is unbelievable. And the array of knowledge they possess on a number of topics is inspiring. If you've ever watched them and as they work through their inspections. This past week, we had 2 food recalls that we have addressed. One was with animal cookies, and we were alerted to that. It went, the distributors were at Target. Obviously, we have a Target store here in Kalispell. Our sanitarians reached out to them
They checked their inventory, learned that they didn't have any of the affected product, and they were anticipating a shipment in that day. They called back and said, nope, we're good to go. Nothing was metal filings in the cookies, so I don't know how they got in there, but fortunately, we didn't have to deal with that. The other one is a baby formula recall, and we're waiting here on that regarding the distribution. They had some limited distribution information, primarily overseas, but there were some domestic distribution stuff. So once we learn about that, we'll get that information out to the public. Over the last month and a half or so, we were able to obtain cell phones for our staff members that go out in the field. And the two primary reasons, well, three actually, for obtaining those were safety. You know, if they're out in the field and they don't have any way to contact somebody for assistance, whether it's a vehicle broken down or they're having a difficult time with someone out in the field. And then efficiency, you know, many times they'd be out there and would be running late on an appointment. They could reach out to an installer or you know, citizen that they're scheduled to meet with, make arrangements to have that meeting a little later on. And then the third one is they'll be able to, with the new time card system, utilize their phones to clock in and clock out. We installed a boardwalk around the Kalispell Air Quality site, which is over on the corner of Woodland and Center Street. Previously, it's kind of where the old substation, the Flathead Electric substation is there. And if you've ever walked back in there, it's like super muddy at certain times of the year. So previously, people had put concrete pavers to walk on to stay out of the mud and all that. Well, those had become a rubble field, if you will. And it was creating a tripping hazard and safety issues. And in the wintertime, it was difficult to shovel. So we hatched a plan to put some pallets down there, put plywood on top of it, purchase paint that has like a gripping surface. We're gonna paint that. So now there'd be a smooth surface where people aren't having to walk in the mud or trip over rocks, and they have to put a ladder up when they do their air quality inspections to get up on the top of the building as well. So now they'll have a smooth surface where the ladder's not sinking into the mud. That's really all I wanted to share, and let's see if any questions for me.
Any questions? Jim?
Thank you.
Great, thank you. Okay, next up is finance. Hunter.
Good afternoon. This is the finance report ending for September, and not much to say other than we're in pretty good shape. About $1.2 million in cash and good start to the year. I would just add to what Jen mentioned about the budget cut there for the cancer program. That won't happen until fiscal year 23. So the state was pretty good about giving us a heads up about what was going on. So that's really all I have. I don't have any additional details. And so any questions on the report?
Any questions?
Is there anything still lingering out from the home health?
There is. Physical part of that's been wrapped up. Right now, we're just in the mode of collecting accounts receivable. So there's about $250,000 of net accounts receivable, and we've got about $170,000 negative cash balance. But it's going to take months for it to trickle how that happens. So, but,
So we're hoping that the accounts receivable will make up for the negative cash balance, kind of, and then we'll kind of make even.
actually, that's, I think, exactly right.
Do you believe all that will be recoverable? the accounts receivable?
So far, that is the net accounts receivable, but it just depends on several factors. So the insurance companies, their responses, and the gentleman that was working on accounts receivable is still working that with different items that of course, that have to be resolved, so. But like I say, if we can get down to where there's no deficit. then- That-
Okay, all right. Stuff is health officers.
So Kirk kind of downplayed the physical aspect of home health, but Kirk is a warrior that has basically single-handedly taken apart home health out there. So great kudos to him. And then they did have a team of, I think the CD group went over to help, and immunization went over to help, and maternal child health went over to dismantle that. So there was a lot of excess supplies. We were able to get a ton of them to the jail. So they were able to get bandages and those kinds of things so that we were able to recycle those. And then there was just a lot of stuff in there after 14, 15 years of accumulation in that building. So Kirk organized it, got it cleaned out. And so thank you, Kirk, for all of that, because without him, we'd still be mulling around in there. So the biggest thing that we've been working on, that I've been working on, is the biosolids plant. So that hopefully is going to be moving forward. We did have, the commissioners did sign a buy sale. It seems like it was weeks ago, but I think it was just last week.
Yeah.
The individual that they had offered it to declined it. And now, after another meeting and some other wrangling, we've done a counter offer, and it looks like they've accepted it. So we're waiting on some signatures, and it goes on the commissioner's agenda tomorrow for them to look at that. So if we can get that, that would be amazing to move forward. As I've been in,
That's the property.
that's the property, it's just the property. So HDR is still working on their plan, and so that's continuing there. But this is just to secure the property so that they can move forward with all of the things that they have to do to make sure that that land is actually usable for the purposes that we would need it for. So it's been a process. It's been a learning curve. So hopefully this is going to be moving forward. And commissioners have been great, and everybody involved has been great with that. So
Kudos to finance too. They've been on top of it.
Yeah.
All along.
And Roger's been very involved, and we keep an artist, because I keep on running into artists, keeping her apprised as we go. But Roger's been involved with all of the meetings as well, so that he's apprised of it, and he'd be giving the update much more eloquently than I today if he's here. But the other things that I had were the flu clinic. It was a pretty good success. I mean, over 1,100 vaccinations, which is great because it just stops people from going into the clinic all the time. So it, kind of, we can get it all done in one fell swoop, and then people will trickle in through the rest of the season. The hail damage, we're still kind of dealing a little bit with that. Still trying to get the cars fixed. It's a long process. We are getting rid of 4 cars. Luckily, we had 2 cars already that were damaged, budgeted, that we already have ordered and ready to come in. And then the commissioners did approve for us to be able to get the 2 cars that we had budgeted for next year. Those 2 cars were also damaged. It just wasn't worth to fix them because they were so old, and we needed to circle them out anyways. So we're going to be able to get those replaced as well, and got those ordered. I did talk to Pam, and then we've talked to CD staff just about suspending the COVID report. The reason is it's just kind of what it is right now. When Lisa sends it out that we are going to suspend it, she is going to give the links to community transmission and to community levels. And she will give the links so that people can check it at the CDC site. So people, if they're still interested, they can still check it, but then it's not as time consuming for Lisa to put that together every single week and get that out. So.
Is it possible for those numbers to just get put in the CD report? Would
Yeah,
that,
we
would
could
that
do it
be more
monthly.
work, or it just seems
Yeah.
like it almost belongs there?
I mean,
I can definitely help with something.
Yeah. She's gonna still be tracking. I mean, we still have to report and everything else, so she's gonna be tracking. It's just to that level. So, yeah, we can put that in the city report.
Thank you.
And everybody kind of touched on the other things I was gonna touch on. So the shelter overflow, we will work on that. And I think it's important that we engage the animal control as well. They're the ones that are out there also working with the individuals when the animals are at large, and they do a great job of returning the animals to them. Thing like Cliff had indicated is that I think our chip program, because we do microchips for $25 for the public if they need them. I think that program has helped. Would you say, Cliff?
Yes.
Because people are getting their animals back in a timely manner, and because they're microchipped, and $25 is pretty reasonable to be able to get your animal back quickly. So the animal wardens are good, is that if they can scan it and they have the equipment with them, they will scan it and return it to the individual at that time. So any questions?
Questions for the health officer? So next item is committee reports, and the environmental health committee, Jen pretty much gave the update. I don't think we met. We could just have side meeting with Jen.
Haven't we got an upcoming meeting?
We do have an upcoming.
We do. We have an upcoming meeting next week to talk about a variance that was granted in April. And to get too far in the weeds, it's the individual perhaps changed some things from the variance that you guys granted. So we need to look at that because our staff does not want to sign anything that hasn't been approved by the board to see if these are allowable changes or what it is. So that's what we're doing.
Have we got any more variances coming forward through where?
Nothing in the immediate future. But there are some complex things that we're working through, so I would suspect yes. In the future.
All right. Anything else? Board member discussion. Should we start online? Jessica, do you have anything?
I do not have anything. Thank you.
Raleigh?
Nope, all is good. Thank you.
I have nothing either.
Right.
All of my questions have been answered. Thank you.
Pete?
It's your food shop.
Okay. And Don?
Nothing.
Same here. I have nothing. So, would someone like to make a motion to adjourn?
I make a motion to adjourn.
Second.
All in favor?
Aye.
Aye.
Any opposed? All right, we're
Might stay
adjourned.
here a little longer.
Yeah.